The enigma. Why is US healthcare expensive but life expectancy not high? Why is Chinese healthcare so cost-effective? In today's globalized era, the healthcare systems of various countries are like complex puzzles, each piece holding a unique story. When we turn our gaze to the two major powers, China and the United States, a series of perplexing phenomena emerge, like a thick fog waiting for us to clear. The US, a global economic and technological giant, pours astronomical sums into healthcare, yet its per capita life expectancy isn't as dazzling as its investment. China, on the other hand, with relatively limited healthcare spending, has not only built highly cost-effective medical services but has also surpassed the US in indicators like per capita life expectancy. What secrets are hidden behind this? Today, let's delve deep and unravel this mysterious veil. Before we explore further, let me tell you a story. A Chinese person who had lived in the US for many years accidentally slipped and injured their leg. They called 911 for an ambulance. For a mere 10-minute ride and a simple on-site check, they received a bill for a staggering $5,000. This was just the beginning. Subsequent treatment costs were outrageously high. In China, for the same injury, from calling an ambulance to hospital treatment, the total cost might only be a few hundred RMB. Is this huge contrast just a coincidence? In fact, it reflects the vast differences in the healthcare systems of China and the US. This disparity is not an isolated case but is widely present across several key areas, including healthcare expenditure, medical services, and life expectancy. Next, we will comprehensively compare the healthcare systems of China and the US from these perspectives to understand the underlying mysteries. Healthcare expenditure, the US's high investment versus China's cost-effectiveness. The United States stands unrivaled globally in terms of healthcare expenditure. According to data released by the US Embassy in China, in 2018, total US spending on healthcare reached an astonishing $3.6 trillion, with a per capita expenditure of $11,172, accounting for 17.7% of its GDP. The average annual income in the US is $38,600. Even with this, a high healthcare expenditure puts immense pressure on ordinary people. Even with 70 to 80% reimbursement from health insurance, individuals still have to bear $3,128. In contrast, China's per capita healthcare expenditure in 2020 was 1,843 renminbi. After medical insurance reimbursement, the per capita burden was only a few hundred RMB. China's per capita disposable income in 2020 was 32,189 renminbi, with urban residents having a per capita disposable income of 43,834 renminbi. To put it into perspective, the average annual income in the US is about 8 times that of China, but its per capita healthcare expenditure is more than 40 times that of China. The high cost of US healthcare can be seen from the daily ambulance fees. In the US, calling an ambulance easily starts at $3,000, and if there's anything serious, don't expect to leave the hospital for less than $10,000. In China, ambulance fees are much more affordable, with a few hundred RMB solving the problem. The exorbitant healthcare expenditure in the US stems from its complex healthcare system. There are numerous private hospitals, highly market-driven medical services, and high costs for medical equipment and drug research and development, all of which are passed on to patients. At the same time, there are many intermediaries in the US healthcare system, such as insurance companies and medical brokers, whose operating costs also contribute to the high medical expenses. China, on the other hand, is dominated by public hospitals, and the government's significant investment in healthcare ensures the accessibility and low cost of medical services. The continuous improvement of the medical insurance system further reduces the burden on the public. In terms of healthcare expenditure, China has achieved more with relatively less money, demonstrating extremely high cost effectiveness. 2. Per capita life expectancy, China's overtake and the underlying logic. In 2020, a surprising statistical comparison emerged. China's per capita life expectancy was 77.3 years, while the US's was 77 years, with China achieving an overtake. Even in 2019, before the pandemic, the US's per capita life expectancy was only slightly higher than China's. It's perplexing that despite spending such enormous sums on healthcare, the US's per capita life expectancy has improved slowly. In fact, there is a serious imbalance in the allocation of healthcare resources in the US. A large amount of medical resources is concentrated in the hands of a small number of elites and some middle-class individuals, whose lifespans are extended through high-end medical technologies and services. A larger proportion of the population, the low-income group, finds it difficult to access quality medical services due to economic reasons, leading to shortcomings in the prevention and control of chronic diseases and infectious diseases, which drags down the overall per capita life expectancy. Additionally, issues such as drug abuse, widespread gun violence, and increased maternal mortality rates in U.S. society also negatively impact per capita life expectancy. In contrast, China has been committed to improving the health of all its citizens, especially focusing on healthcare access for low-income populations. By improving the grassroots healthcare system, medical services are brought to every household. Significant achievements have been made in infectious disease prevention and control, chronic disease management, and maternal and child healthcare. For example, during the COVID-19 pandemic, China quickly established a comprehensive prevention and control system, provided free vaccinations to the public, and maximally protected people's lives and health. China has raised its overall per capita life expectancy by improving the health of its low-income population. Moreover, with China's economic development, investment in the healthcare sector continues to increase, and there is still significant room for improvement in per capita life expectancy. 3. A number of hospital beds, the difference between ICU and general beds. After the outbreak of the pandemic, some public intellectuals boasted about the number of ICU beds in the US, claiming that the US had 34.7 ICU beds per 100,000 people, ranking first in the world, while the EU averaged 11.5, and China only had 3.6, far below the US and even below the world average. However, they deliberately ignored China's advantage in the number of general hospital beds. According to 2020 data, China had 630 general hospital beds per 100,000 people, ranking first in the world, while the US had only 290, with China surpassing the US by double. This data difference reflects the different strategies of China and the US in healthcare resource allocation. The US invests more resources in the construction of high-end ICUs to meet the needs of elites and some middle-class individuals for critical care. China, on the other hand, focuses more on the popularization of basic medical services, ensuring the daily medical needs and treatment of common diseases for the vast majority of people by building a large number of general hospital beds. In terms of cost, a Chinese ICU bed costs about 10,000 renminbi per day, including bed fees, treatment fees, etc. An American ICU bed, however, costs about 170,000 renminbi per day. For ordinary people, Chinese medical costs are much more affordable. With limited medical resources, China prioritizes ensuring the basic medical needs of the majority, a resource allocation method that reflects the people-centered philosophy of the Chinese healthcare system. 4. Healthcare worker income, the cost considerations behind it. Globally, doctors are generally high-income earners, at the pinnacle of the middle class, or even with one foot in the upper class. Doctors in European and American countries earn surprisingly high incomes, and we often see doctors living dignified and elegant lives in European and American TV series. Even in developing countries like India, doctors' incomes are relatively high. India's healthcare industry is highly market-oriented, although intern doctors have low salaries. Once they become official doctors with practicing licenses, their income is quite substantial. Public hospitals in India once struggled to recruit doctors with a monthly salary of 125,000 rupees, approximately 13,000 renminbi, and even raising the monthly salary to 200,000 rupees, approximately 21,000 renminbi, still had little effect. In contrast, although Chinese doctors' incomes are higher than the average social wage, there is a clear gap compared to their counterparts abroad. Chinese doctors have extensive social connections, but their salary income does not differ as much from ordinary people as it does abroad. This is partly due to China's socialist system, which emphasizes the public welfare nature of medical services. On the other hand, there are differences in the training methods for doctors in China and abroad. In the US, the cost of training a doctor is extremely high. Medical students not only undergo a long learning process, including 4 years of undergraduate study, 4 years of medical school, 4 years of hospital training, and 2 years of internship. From elementary school, it takes 26 years to train a qualified doctor, and at least 32 years to obtain a Doctor of Medicine degree. Moreover, U.S. university tuition fees are expensive, with medical students spending around $1.5 million on tuition fees alone, not including student loan interest. Such high costs mean that U.S. doctors demand high salaries after becoming officially licensed. In China, university tuition fees are relatively low, and medical students can complete their studies with almost no high tuition fees, as the state covers most of the training costs. Following the principle of low risk, low reward, Chinese doctors' incomes are relatively lower. However, this also reduces medical costs, which ultimately translates into low medical fees that the public can enjoy. Through this method, China trains a large number of doctors at a lower cost, meeting the medical needs of the public. Accessibility of medical services, a big difference between China and the US. In the US, only the elite dare to enjoy top-tier medical services without reservation. Calling an ambulance, going to a top hospital to see a specialist, these are unbearable burdens for ordinary people, especially the poor. The uncrowded nature of top hospitals in the US is not due to abundant medical resources but because exorbitant costs deter most people. In China, however, tertiary hospitals, sanjiayuan, are often crowded. This is not due to a lack of medical resources, on the contrary, it reflects the accessibility of medical services in China. No matter who they are, as long as there is a need, they dare to call an ambulance and can go to a tertiary hospital to see a specialist. China's healthcare system is committed to providing equal medical services to all its people, and the wide coverage of medical insurance ensures that ordinary people can afford to see a doctor and get good treatment. In terms of the price of medical services, the US is undoubtedly the world leader, with its high costs deterring many. But in terms of the cost-effectiveness of medical services, China is second to none. China provides extensive and high-quality medical services to its citizens with lower healthcare expenditure, truly benefiting all its people. Through this comparison of the US and Chinese healthcare systems across various aspects, including healthcare expenditure, per capita life expectancy, number of hospital beds, healthcare worker income, and accessibility of medical services, we can clearly see that the healthcare systems of both countries have their own characteristics. The US has advantages in high-end medical services, but the high costs make them inaccessible to ordinary people. China, on the other hand, with its highly cost-effective medical services, guarantees the basic medical needs of all its people and has surpassed the US in indicators such as per capita life expectancy. So, in your opinion, which healthcare system, China's or the US's, is superior? Feel free to leave your comments and discuss below.